So this is not an uncommon scenario here in the CVICU. As you can see, there are 3 IV pumps, 4 channels each, multiple infusions running into this patient who has a Swan line. So, let's take, for example, epinephrine. This is currently running at the standard concentration. We know that because this bag came stocked out of our Omnicell. So you can go and grab that when you need a replacement. So to switch to concentrated, you would have a new bag. You'd need new tubing that would be programmed fresh into the pump with the non-standard settings. This tubing then flows all the way down here into the manifold. As you can see, carrier enters here, multiple drips running through the manifold. This then exits the manifold in this small gauge tubing. The reason why this is specialty small gauge tubing is to try and reduce that higher risk of lag time with drip changes to reach the patient. So that's why this has been manufactured to be a smaller gauge. If you imagine though, all these drips are entering this manifold and running at different rates. So the fluid that's running through this actual pretty wide gauge manifold is in a certain mix. It's like making a cake. All of the ingredients are in really intricate proportions, which then exit through this small gauge tubing. That tubing is actually quite long. It's long enough that people can get up out of bed and it'll reach from leaving the bed and getting into the chair. So that's a fair bit of volume there. To be honest, I have no idea what the volume of that actually is, and I assure you that most practitioners do not as well. This then enters usually the infusion port or the side port of a Swan. In this case, it's entering the side port. It also might be entering the infusion port, which is built in to this yellow sheath here, which is the Swan. So if you can imagine, we now want to concentrate our epinephrine. So that's new bag, new tubing for all medications going down into our manifold. We got to try and get the right mix of medications through that manifold, through that tubing, through the Swan. So to do the math on how to make sure that that mix is correct, and when that new concentration, that new recipe for our cake is actually entering the Swan, traveling the length of the Swan, and actually hitting the bloodstream of the patient, is near impossible to ensure when that switch is going to happen and when those rates really should be changed over. So a very complex situation to try and get that different drug mix to the patient. And especially, we'll talk about this later in some of those volume charts, but for epinephrine, sometimes your rate, when you go to a concentrated drip, right now it's only running at 8 mils per hour. Our epinephrine here is concentrated 5 times when we ask for concentrated drips. That often drops your drip rate to around 1 mil an hour, which, if you can imagine, has to travel all that tubing and reach the patient. How do we really know when that 1 mil an hour is going to be able to reach our patient?